Hello everyone, welcome to my channel Register as Nurse, your go-to destination for all things related to nursing in Canada. My name is Jasmine and I'm a registered nurse in Canada. So in this video, we're gonna discuss about NCLEX exam, its administration and what it takes to meet the passing standard of NCLEX exam. So without further ado, let's start our video. So whenever you're going for your exam, you should know that you will be provided with a 5-hour period of time. That means you will have a 5 hours to complete your NCLEX exam. And there is a minimum item and maximum item that you should be aware of. So minimum item means all RN candidates have to answer 85 items. That's your minimum. All candidates have to answer that. And the maximum item that you have to answer is the 150 items. So the 150 is your last item of your exam. And you will have the 5-hour period to answer those items. And another important thing you have to know that NCLEX exam is administered to candidates through the computerized adaptive technology, computerized adaptive testing, which is also known as the CAT. So this technology basically uses the computer technology and measurement theory. So what's that mean? That means that computer will select an item for you. On basis of your response, computer will determine whether computer will determine your potential availability and then will administer your next item. So say when you turn on your computer on exam, computer administer you one item that is listed as the easiest one according to the measurement theory, and you want to respond that item correctly, then the computer will administer you the next hard item, and so on process will continue until the computer determines that you fail or pass the NCLEX exam. So this is the basic administration process of NCLEX exam, which work through the computerized adaptive testing, which is also known as the CAT. So next thing regarding administration of regarding the exam length, we discussed that the minimum items are 85 items. So how those 85 items are distributed in NCLEX exams? So from the minimum item, 52 item will be from the client care categories, which we already discussed that. So you will get 52 item from those 4 categories. Then you will get the 3 clinical judgment case studies. As you know that now we are in the age of the new generation NCLEX exam. So in this new generation NCLEX exam, they will administer you 3 clinical judgment case studies that include the 18 items, and then the another remaining 15 items will be unscored pretest items. So this is how your exam is distributed on basis of items. So next is very important question, what is the passing standard? So this passing standard, this one is decided by a board panel of expert, and the board re-evaluate the passing standard once every 3 years. So last it was done in the 2022. So basically a board of expert, panel of experts sit together and they decide what should be the passing standard for next coming 3 years. And then after their common decision, those passing standards are applied to each and every exam. And decision are made whether the candidate have ability above those passing standard or below those passing standard. If your ability is above a passing standard, you pass the exam. If your ability is below the passing standard, you fail the exam. And there are the 3 main scenarios on that basically decide how computer will make that decisions. So let's talk about those scenarios. So number first scenario is the 95% confidence interval rule. So this scenario is the most common scenario. So here basically when computer is 95% sure that your ability is above or below the passing standard, it will stop administering your exam. So computer will stop administering items when it is 95% certain that candidate ability is either above or below the passing standard. So next scenario is the maximum length exam. So maximum length exam, as its name indicates, maximum length means that you reach the 150 items. So some candidates ability will be very close to to the passing standard. So in that case, computer disregard 95% confidence interval rule, and at this time the computer will make the decision on final ability estimate. So if your final ability estimate is below the passing standard, candidate fail. If the final ability estimate is at or above the passing standard, candidate pass. This is the second scenario. Now let's go to the third scenario, which is known as the run out of time rule. And as its name indicates, run out of the time rule means you run out of the 5-hour period. So as you know that they will give you 5 hours to answer 150 questions, right? But what if candidate run of the time before reaching the maximum number of the items and computer has not determined with the 95% confidence level? So at that time, two conditions can happen, right? Number one, if the client has not answered minimum number of the item, that is 85 items. If client has not answered the 85 item, then client is or candidate is automatically fail. But if the candidate answered the 85 item and ran out of the time, then the computer automatically make the decision on the basis of final ability estimate. So again, if ability estimate is at or above the passing standard, candidate pass. If it is the below the passing standard, candidate fail. So these three scenarios basically determine whether you're gonna pass NCLEX exam or you're gonna fail the NCLEX exam. So it is really very important that candidate has answered at least 85 items, because if candidate fail to answer 85 items, that it means candidate is automatically fail. And it is it's recommended that candidates should spend about 1 to 2 minutes on particular item in just order in to make a pace with your exam. Just to answer the 85 question, you must spend at least 1 or 2 minutes on particular items. And you should also know that whenever you are taking any break in the NCLEX exam, your time keep going on. I mean, they are not going to stop clock for you. Your time keep going on. Your breaks are included in those 5-hour period time. So you should be very careful whenever you're going to sit for your NCLEX exam. So that's it about this video. If you have any question or you want to know more about the NCLEX exam, please post your comment in the comment section. And if you want to see more nursing related content, please subscribe to my channel. Thank you.